Hello, I'm Erica Slade with E-Tellect Coaching. We're continuing our series on children 9 to 18 months. I want to talk about food. So most of you have a pretty good baseline on food introduction. That's something that's really cultural, honestly, in nature. It's one of those things that we introduce different foods based off of our own preferences, our own cultures, our own upbringings, education, and things of that nature. Just want to remind you to know some foundational components on how children learn to eat. Most children learn to chew food faster or quicker than they learn to swallow. It's why they spit out so much food when you're giving them purees. It's because they naturally, when you start introducing food and it's not a bottle, they chew before they swallow. So we would do better to cut up very small bite-sized portions of food, make sure that they're very chewable and they're not a choking hazard, and to give them those as their first foods instead of, say, a puree or something like that. One of the points I want to pin in, though, because there's lots of information out there on food introduction, not as much on the epidemic of oral satisfaction. So I just want to put it out there that we do not encourage, and I encourage you not to give your child a bottle, a pacifier, or to nurse in response to every negative feeling that child may feel. So you may have a 9-month-old, and when they get frustrated, we give them a bottle. If they are super tired, then we nurse them. If they experience pain, then we give them a pacifier. We should offer instead loving comfort in those situations. So we want to love on them, we want to hug them, we want to give them a physical component, we want to be with them, we want to talk to them and interact with them and soothe them. But we should offer food when they're hungry. Not as a source of comfort when they have experienced these emotions. If we're forecasting and we're looking at the long game, we want to make sure that our child has a healthy association with food, and that food stays something that they ingest for nutritional value, and not something that they go to for comfort. As a growing adult, we want our little human to grow into an adult human that eats food for nutrition and not out of psychological needs. So we want to make sure that any kind of oral satisfaction that we are giving them is necessary. If we're giving them their bottle, if we're nursing them, if we're giving them a pacifier, if they're sucking on the finger, that we make sure that we're delineating between the things that are necessary at that time and the things that we can maybe provide comfort in a different way, and not just to solely use those methods as methods for that child to comfort themselves. Maybe we can step up our game a little bit and comfort them by hugging them, by talking to them, by loving on them, by reading a book with them, by taking a walk with them, by taking them to a window and letting them look outside, by working through those emotions with them in a different way, but not making our go-to, our end-all be-all be a bottle or nursing or a pacifier. We want to make sure that as we're forecasting them and vision casting and planning for them to be an adult, that we have helped them lay a foundation that allows for a healthy association with food. I hope you learned a little bit today, and I hope you're inspired to continue to learn tomorrow. Thank you so much. Have a great day. Bye-bye.